Hello, I'm Suzanne Arnold. I'm a cardiologist with St. Louis Mid-America Heart Institute and UMKC in Kansas City, Missouri, and a volunteer for the American Heart Association. We know there are a lot of concerns and questions out there about what the coronavirus or COVID-19 could mean to people living with heart valve disease, such as aortic stenosis. Let's take a look at some of the common questions we're hearing. At most hospitals, the scheduling of surgeries and procedures is constantly being monitored, balancing the risk of waiting until there are fewer COVID-19 issues versus the risk of proceeding now despite these infection concerns. Generally, people who are at higher risk in terms of their valve disease are continuing to have the procedures done, whereas it may be safer for people who are at lower valve risk to wait a few months until things settle down a bit at the hospitals. I encourage people to discuss this more with their physicians if there are any questions. Trust that the physician is weighing many factors when deciding whether to proceed or to wait, including the echo, frequency of hospitalizations, symptoms, other comorbidities, as well as the local conditions in terms of infection risk. This is unfortunately a unique time when there are both risks of proceeding and risk of waiting, and we are constantly trying to balance these risks in each individual patient. When you're exposed to the healthcare system right now, or you have a longer hospital stay, there's a greater risk of being exposed to COVID-19. People should be reassured that hospitals are trying to keep all patients with suspicion of or with COVID-19 separate from other patients, as well as doing extra cleaning and sanitizing to reduce this risk as much as possible. If you get COVID-19 while recovering from the surgery or procedure, either in the hospital or when you return home, the infection could be more difficult to beat. However, it's also important to recognize that there's also risk in waiting to do the surgery or procedure until the infection issues are lower. There's a reason we have scheduled the surgery or TAVR. Severe aortic stenosis increases the risk of sudden death, and so we wouldn't want to wait too long to intervene. If the physician thinks it's important to proceed with a surgery or TAVR during this time of COVID-19, it is probably because he or she thinks that the risk of waiting is higher than the risk of proceeding, understanding that this can be a tricky balance between these two risks. The most important thing is to stay healthy and stay as active as possible. Physical distancing is important so you don't get COVID-19 prior to surgery or the procedure. Therefore, you should stay home as much as possible. But it is also critically important to maintain good nutrition and keep up physical exercise during this time. The healthier you are going into the surgery or procedure, the quicker the recovery. And this means fewer complications, shorter length of stay, and faster recovery after returning home. It is also important to monitor symptoms from the valve disease and notify the physician if things start to worsen, as scheduling of the surgery or procedure may need to be adjusted, or the person may need to be seen either virtually or in person at the clinic or hospital for further medication adjustment. While it's a good idea in general to avoid the healthcare system at this time to limit exposure to COVID, it is also really important not to wait too long to get care if you need it, just because of these fears. Finally, all people waiting to have surgery or a procedure should check their temperature daily and let the healthcare team know if it's over 100 degrees. And many places are routinely testing people for COVID-19 before coming in for these surgeries or procedures to avoid exposing staff to the virus. Generally speaking, we would expect COVID-19 to present fairly similarly in a patient with valve disease, with fever, dry cough, shortness of breath being the major things to look out for. Due to the underlying aortic stenosis, the shortness of breath may be worse than in a person without valve disease. But it's also important to note that not all shortness of breath is COVID-19. people with aortic stenosis are still at risk for progression of the valve disease or heart failure, which would also often present as shortness of breath. It is important in this situation to not self-diagnose, but to seek care, as either COVID-19 or worsening heart failure from valve disease would be important things to treat as early as possible. COVID-19 should not impact the severity of the actual valve stenosis or make the valve more calcified. However, as both COVID-19 and aortic stenosis often impact breathing, the two conditions could compound each other. While COVID-19 can attack anyone, people with underlying medical conditions are at greater risk for developing serious illness with COVID-19. This is likely the bigger concern. Not that COVID-19 makes the aortic stenosis worse, but that the aortic stenosis will make COVID-19 harder to beat. People with aortic stenosis, or those who have just had a big surgery or procedure and are recovering, have decreased reserves, meaning they will have a more challenging time recovering from any big illness or injury. It is therefore incredibly important to be extra cautious during this time to avoid contracting COVID-19 with physical distancing, hand washing with soap for at least 20 seconds, or hand sanitizer containing at least 60% alcohol if soap is not available, wiping down surfaces with disinfectant, wearing a mask whenever in public, and avoid getting out in public as much as possible. You should also avoid touching your eyes, nose, and mouth with unwashed hands. We realize this is a challenging situation for patients, but we're here to help with reliable information based in credible science. For the most up-to-date resources relevant to heart disease, health, and well-being, visit the American Heart Association at heart.org/coronavirus. And for the latest developments about coronavirus precautions and government guidelines, visit cdc.gov.